So you ask, we heard, right? This is good, real time. But no, one of the key, as I said at my introduction, a key premise for the planning committee was to start with the person and not a patient. Because I think in some sense, patient is even beginning to say, when you're in the healthcare system, you're a patient. But starting with the personal perspective was critically important because all this work is about individuals, human beings, improving our health and well-being. So we're incredibly honored to have Jeromie Ballreich here, who is a fourth-year doctoral student in health economics at Johns Hopkins University, to share his perspective and to kind of ground us in his reality and share some thoughts with us. So please welcome Jeromie.
I hope you guys could hear me okay. Nope. Okay. Sorry about that. There. That should work out great. Okay. Wonderful. Thank you for the opportunity to present at this workshop. When my advisor, Dr. Jerry Anderson, asked me if I could present as someone who is, quote, medically high needs, I was hesitant at first. I was hesitant because I do not like to talk about my condition. And also because, thank you.
Sorry, guys.
Yeah. I think this will be okay. All right. I think I'll stick with this one. Anyways, I was saying I was hesitant because I do not like to talk about my condition. Also, I do not want to be defined by my condition. With that said, I agreed because I think the patient's perspective is important. And while my perspective is unique to myself and not fully generalizable, I do think it complements the existing data and clinical knowledge while providing unique insights. So let me begin. I became a medically high needs patient in March 2005 because of a traumatic spinal cord injury after diving into shallow water. I remember distinctly floating face down and being unable to turn over to get breath, but that's all I remember of the situation. Fortunately, a friend of mine noticed my body floating and noticed my discoloration, pulled me ashore, and where I regained consciousness and was transported to a local hospital. I spent 13 hours in the Bahamas while an air ambulance crew negotiated payments for my life flight to Miami. After I was flown to Miami, which became my de facto home for the next 4 months. Initially, my prognosis was promising because of, at the time, my athletic frame, but the salt water near drowning severely compromised my lungs, and within days I was trached and battling severe lung problems. After 2 months in the ICU, I was discharged to Miami's inpatient rehab, slimmed down from a healthy 190-pound frame to a meek 130 pounds. After 2 months in Miami's inpatient rehab, it was decided to transfer me to McGee Rehabilitation in Pennsylvania, where I was closer to both family and friends and could continue my rehab. However, I only remained at McGee for 6 weeks before being discharged as C5 quadriplegic. Being a C5 quadriplegic inevitably means I am a medically high needs person. But what does that really mean to me? The quadriplegia and spinal cord injury affects multiple organ systems. And because of that, I see multiple providers. I see primary care physicians, I see urologists, neurologists, podiatrists, gastroenterologists, and radiologists all within the past year. And in many cases, I see these providers multiple times. Besides requiring all this medical attention from the providers, my quadriplegia also means I need substantial assistance with nearly every major daily living activity. My assistance begins in the morning with near or full or total assistance for all the morning things that normal human beings do: washing, personal hygiene, dressing, bathing, etc. Throughout the day, I need substantial assistance with many instrumental daily living activities. For instance, there are very few punctual public transportation options in Baltimore. Consider trying to get onto a crowded city bus in a large electric wheelchair. It just doesn't work. So a caregiver drives me to and from Johns Hopkins campus where I do my schoolwork. I'm adept at using a computer, but I need someone to set up. And also things such as laundry, I need someone to assist me with, which fortunately for me is one of the few benefits of being a quadriplegic. All of this takes time and requires someone to assist me. And as a health economics student, I am acutely aware of the fact that high needs means high costs. However, that's not the focus of my presentation, mostly because of the insurance, I'm insulated from most of the costs. I could continue giving facts and figures about being high needs, but I feel my perspective is best conveyed through personal experience in the 4 topics listed. I want to begin. While in inpatient rehab, I worked with multiple social workers to plan my discharge, including answering the important question of what comes next. I worked with 2 social workers, one in Miami and one in Philadelphia, and am amazed at how much influence a single person can have on my life. The one social worker had what appeared to be little knowledge of resources available, was not engaged with the clinicians or therapists, and whose only suggestion was placement in a nursing facility, and even that she was lacking details. Fortunately, the other social worker was engaging, willing to explore resources available, and did an excellent job at laying the groundwork for what would become my future. Despite her help, access to support services were slow, and initially my mother became my primary caregiver, which meant she was foregoing her own professional career. The return home was a rocky transition. I was not fully healed when I left acute rehab. I was a novice to all things spinal cord injury related, and as such dealt with many medical setbacks, which is a recurring life theme. In fall 2006, a bad chest cold developed from a chest cold to severe pneumonia over the course of a week, resulting in me being life-flighted to Hershey Hospital. I've dealt with multiple catheter issues and at times autonomic dysreflexia, which for those who don't know, is a severe life-threatening condition for people with spinal cord injury. Over the course of intermittent hospitalizations, I was forced to deal with their souvenirs, being notably MRSA and C. diff. Most of these setbacks, medical setbacks, were overcome through acute care, but are really prevented through adjusting my day-to-day medical care, and also with trial and error. I would not be here today without the tremendous family and community support. Being in a small town meant that the doctors had personal interest in me and would go above and beyond addressing my health. It's also worth noting that my friends and community all helped with getting me healthy, getting me back to school, and getting my life on track. Quadriplegia is not my main health concern, but it's all the side effects. And one area where there's side effects and that's concerning is my skin integrity. In the picture, you could see a recent pressure ulcer that was which fortunately is healing. And in the past 10 years, I've dealt with multiple pressure ulcers. And for a quadriplegic, these pressure ulcers are a major concern because you have to be proactive. They can devolve and resulting in both hospitalization and at worst case, death. In hopes to prevent or heal many of these pressure ulcers, I've consulted with multiple doctors and visited 3 distinct wound clinics. From this experience, I found specific advice on wound healing to be generally inconsistent. They all generally advocate pressure relief. But in terms of dressings, it's been more of a trial and error experience for myself. And despite the myriad of advice, of which some of it is ineffective at best, the best advice was a wound care doctor who's emphasized good nutrition, especially increased protein intake. I should note that she was the only doctor that I saw that emphasized both a link to the protein as well as nutrition to wound healing and skin integrity. The takeaway from my day-to-day medical care experience is that I have to be proactive, and this requires time to heal, it requires time to visit multiple providers, it requires research and knowledge, and the ability to make adjustments to my schedule. as well as a level of skepticism to find out what works and what doesn't. The day-to-day medical care starts with me, but also starts with my caregiver who provides the majority of my hands-on care. And talking about caregivers, caregivers are in your life and in your home. I have a caregiver who's a great hands-on caregiver. He is very reliable. He provides great assistance with both ADLs and IADLs effectively and efficiently, and does a great job with my day-to-day medical care. However, working with someone one-on-one with such personal care means the professional boundary can be stressed, and personal differences can cause friction, both between myself and a caregiver, as well as a caregiver and other people in my life. For instance, I live with my girlfriend in Baltimore, and she knows that I require caregivers. But because we both share the same apartment, the caregiver also becomes part of her life. And that's where personal differences and maintaining a professional boundary is critical. It's also worth noting that coordinating care and caregiving is a job. I did not sign up for this. It requires hiring, firing, scheduling. It also requires a lot of micromanagement. We're talking about where to put your socks. You don't normally direct other people to where to put your laundry. And it's also, I should also mention I'm a very reluctant boss. I'm not someone who wants to constantly be on the caregiver about how to do their job right or better. And it can also be a nightmare. Back during my first year of my PhD program, I hired a living caregiver. She was an LPN. She passed all her background checks, and I compensated both through room and board and hours, and paid hours. It was one Saturday during this time where she left for a lunch meeting. I was expecting her back that evening to assist me with my day-to-day routine. However, come evening, she was still not back. It was not until she did not come back until next morning, which left me in a very potentially life-threatening situation. I need someone, say, for instance, empty my catheter bag. I need someone to help transfer me out of the chair to the bed to maintain my skin integrity. Come Sunday morning at 7 a.m., I was really at loose ends, and I ended up calling my mother, who commuted to 3 hours and was able to fill in for my caregiving. This situation went from awful to worse. She refused to leave my apartment because she had no other place since I provided room and board. I also lent her money as a cash advance on a paycheck, and I never saw that again. So, despite all of these challenges, it's still quite possible to maintain a good work-life balance. My condition is omnipresent. It affects all aspects of my life. And whenever I talk about my work life, I'm here, as a patient, but I'm also hopefully to become a great health economic researcher. Okay. And just like all of you, I have to balance both my work life with my social life. It was just a couple of weeks ago where I presented a poster at the DIA conference in Washington, D.C. The DIA offered to pay for a hotel and expenses, so my girlfriend and I decided to take this opportunity not only for my professional development, but also as a quasi-getaway from hot summer Baltimore. She came with me both as a capacity as my girlfriend, as well as a caregiver. The logistics was a bit stressful. I have multiple medical equipment I have to deal with. I have to make sure the hotel room is accessible, and we have to make sure everything is in proper order. While at the conference, we were fortunate to be invited to a company after-hours party at Smithsonian's National Building Museum. We called and coordinated a wheelchair taxi to pick us up both at the hotel as well as the Smithsonian. Unfortunately, the wheelchair taxi only took us there, so we ended up walking back, which wasn't that far of a walk, fortunately. But once we get back, we have to deal with my nighttime routine, which takes time. She has to help me get me in bed. He tries to take care of all my normal nighttime routine. You know, being a high needs patient, it affects your life. And while you have to deal with the setbacks, you have to deal with the struggles, it's still quite possible to have a meaningful and enjoyable life. And with that, I'd like to thank you for the presentation. Well,